Suppose we have a 75 kilogram patient with a history of insulin-dependent diabetes, and he presents with diabetic ketoacidosis to the emergency room, and you take a blood gas sample, you take an arterial blood gas, and you see that the pH is 6.95, in which the patient is severely acidotic, and you can look on the scale here of metabolic acidosis, in which the pH is less than 7.35, and you can see that the PaCO2, which is 30, because the patient is hyperventilating, which is trying to initially compensate by blowing off the acid, which is the PaCO2, through a process of hyperventilation. And therefore the PaCO2 is low. The PaO2 is normal, although the bicarb is approximately 6. So we can see through metabolic acidosis, in the process of compensation, you'll decrease the bicarb level from 24, for example, all the way through 6 in a very, very sick diabetic ketoacidotic patient. And we can calculate the total body deficit of bicarb using the equation of total body weight in kilograms multiplied by the bicarb deviation from normal, which is normally 24 milliequivalents per liter, and you multiply the fraction of extracellular fluid, which is 20%, we can take our example and saying the 75 kilogram patient multiplied by the deviation from normal, which is 24 minus 6, multiplied by 0.2, which is the fraction of the extracellular fluid. And we can say that the patient is or has a deficit of 270 milliequivalents of bicarb. So if you were to try to replace this bicarb, giving amps of bicarb, we could say 1 amp of bicarb is approximately 50 milliequivalents. This patient may require approximately 5.5 amps of bicarb to replenish the deficit of the bicarb through the process of metabolic acidosis, and in this case, diabetic ketoacidosis.